let's talk about neoplasms. Okay, neo means new. Okay? If you ever watched The Matrix, his name is Neo. There's a reason why it means new. All right. Neoplasms are new growths. It's tumors, stuff like that, okay? It's basically cell growth that's out of control. Not supposed to have it. Doesn't mean it's cancer, but I've got cell growth that's not supposed to be doing what it's doing.
Right.
Okay? In your book, go to kind of the end of the alphabetic index, and you'll see something called the neoplasm table. It's after. Oh, yeah, it's after. Yeah, table of what page does that start on?
466.
Okay, and your guys' 2018 books you just got, it's on page 467, if that helps. Okay. So this is your table of neoplasms, all right? It is organized anatomically and alphabetically. Well, let's say alphabetically first and then anatomically. So you'll see it starts with abdomen, right? And it just keeps on going. You got subterms, just like we did before, because like if you go to bone, then it goes, and then there's all the bones, which is a lot, okay? All right? All right, we're not gonna look this up, I just want to give you this example. So your diagnostic statement says malignant neoplasm of the cervix, right? I'm like, okay, so I go to my alphabetic index and I go to neoplasm, or you know what I'm saying? Because that's, I told you to go to the condition or disease. So I go to neoplasm, and then I go down and it says malignant. You know what it's going to say next? It's going to say see neoplasm table. I kind of always want to start outside the neoplasm table and let it tell me to go there.
Okay.
I don't want to just necessarily jump in there unless I'm feeling really cool about it. And I want to start outside of it and wait for it to tell me to go in there. Okay? Because I don't always, I'm not a clinician. I don't know what is a neoplasm and what's not necessarily just by reading something. Or malignant, okay? I don't know. And then I'm gonna go to cervix, and then you gotta be careful again, because guess what? I'm a female. I have more than I have a cervical spine, and I have another cervix, don't I? Okay, so you gotta be careful. All right. So then I've got, so I want to find what I'm looking for in the neoplasm table, and then I've got those columns, right? See them? Okay. So I've got 3 columns under malignant. Okay. What does malignant mean? If I have a malignant tumor, what does that mean?
Non-cancer. I'm opposite.
Yeah, okay. Yep, okay. Means I have cancer. Mal means bad. Malpractice. Malware. Maleficent. Okay? All right? Mal is bad. So it's cancer. Okay? So, under malignant then, I've got primary, I've got secondary, and then it says CA and situ, right? Those columns. Primary means what it sounds like. It's my original site of cancer, correct? But sometimes cancer spreads, doesn't it? It metastasizes, exactly. Good job. and it spreads to my sternum, my bone, right? I've got two kinds of cancer. My primary cancer is breast. My metastatic cancer, my secondary cancer is bone cancer, right? Specifically in my sternum, okay? So to find those codes, I'm going to go to breast. I'm going to pull breast out of the primary column. And then I'm going to go to bone and then find sternum. And I'm going to pull that out of the secondary column. This is, the breast is my primary cancer. This bone cancer is my secondary cancer.
Okay.
So anything that's the primary cancer comes out of here. Anything that's metastatic or secondary, where it's spread,
Okay.
where it's spread to, okay, is going to come out of the secondary column. Now remember, this can be confusing too because I said my first listed diagnosis is always going to be the reason I'm coming to the doctor, right? Okay. So here, let's just do something fun here. So say I had breast cancer. I get a mastectomy, I do radiation, I get chemotherapy, they come back and they're like, hey, you're good, right? But then I go back in for a checkup and they found it had already spread to my bones. Okay, so I don't have breast cancer anymore, but now I have metastatic bone cancer. You with me? Okay. All right. So now I'm getting treatment for my metastatic bone cancer, right? Okay. My first listed diagnosis is still going to come out of this secondary column because it is metastatic. It's because it's spread. So it's always that. Okay? It's always that. But it still can be my first listed diagnosis because that's what's getting treated. Okay? I know. I'm telling you what. Now, here's where I'm going to make it really fun. I don't have breast cancer anymore, right? But I'm representing everything that's going on in this encounter. So here, I code the history of breast cancer. So when I talk to my husband about this stuff, his eyes glaze over in about 10 seconds. And he starts talking about, I don't know, trivia or something. All right. So we've got primary, which is the original cancer site. We've got secondary, which it means it's spread or metastasized. When I say the carcinoma in situ, which I think your book just says CA, but it's carcinoma in situ, that means it's localized. It's not going to spread. It's just a tumor. Usually they can just kind of excise that out and do like radiation or something like that. And then the patient's good. It's localized. In situ means it's, I always remember like it's situated. You know, it's not going to go anywhere. It's situated. So those are our malignant columns. You have benign, which means it's not cancerous, right? Then, so that's pretty straightforward. But then we have, it says uncertain and unspecified behavior. Because remember, there's always going to be a pathologist involved in this, right? Because they're going to do a biopsy, right? And then a pathologist is going to examine those tissues and make a determination, correct? So typically, I'm not going to code probably anything until I've got that pathology report back, which makes sense, right? Okay. Uncertain means I don't know. Maybe I don't have the pathology report back and I'm going to send that claim in anyway. I don't know. There's a tumor in my shoulder. I don't know what it is. Okay? Unspecified behavior means they can't tell. I we've got a pathologist in Lawrence who loves to do presentations, and they are so gory, but they are so interesting. It's just fascinating, and he just talking. You have to like tell him what time to stop and be like, okay, wrap it up, because he's so fascinating, so smart. But, you know, sometimes they get in there and they're looking at stuff on a cellular level, you know. So sometimes they get in there and the pathologist just can't tell if it's cancerous or not. Maybe the sample was poor. I mean, there could be a lot of reasons for that. So that's really the difference between those two columns. I don't know, or I can't tell. Okay? So we got all those ones for malignant. We've got one for benign. Don't know, can't tell. Okay? So I'm in the neoplasm table. I'm going to go anatomically. I'm going to pull from the right column. Do I still need to check in the back of the book? Yes! Always! Okay?
You keep dancing around until you get thrown back in there.
That's right. Like I said, if you skip that step, sometimes you'll be right, but sometimes you'll be wrong. There are codes in there for symptoms, signs, ill-defined conditions. We saw one of those earlier today when we looked at back pain. And there's a reason for that. Sometimes the doctor doesn't know what's wrong with you. I mean, that's happened to all of us. They walk in there, they don't know